Hello and welcome to Care Conversations, brought to you by NurseRegistry. This is your trusted space for straightforward and useful health topics that matter the most to you and your family. From managing chronic conditions to understanding what quality nursing care really looks like, we're here to empower you with knowledge that makes a difference. I'm glad you're here. Let's get started. Today, we're talking about something that most podcasts probably never cover, but for the right audience, it's incredibly important. How to find and hire the right live-in nurse for a high-net-worth household. If you're responsible for managing a complex household with multiple staff members, physicians, and family dynamics, or if you're a family office professional helping to coordinate care for a principal, this episode is for you. Here's the thing. Hiring a live-in nurse for a high-net-worth household is fundamentally different from hiring home care for most families. The stakes are genuinely high. Hire someone who lacks clinical judgment or specialized experience, and you've compromised the family's health outcomes. Hire someone who doesn't understand confidentiality or household structure, and you've risked your privacy and disrupted the carefully balanced operations that you've worked hard to build. The challenge is that most nursing recruitment firms focus exclusively on credentials while overlooking the subtle but critical qualities that separate a qualified nurse from a truly exceptional fit. You need someone who knows how to protect privacy, coordinate seamlessly with your estate manager, manage complex household dynamics, and provide personalized medical care without crossing boundaries. Today, we're going to break down exactly what to look for in a live-in nurse for a high-net-worth household. Let's dive in. First, let me be clear about what makes the hiring process different from typical home care nursing. In most home care situations, a nurse comes to a patient's home, provides clinical care, documents what they've done, and then leaves. There's clear professional separation between work and personal life. A live-in nurse for a high-net-worth household is different. They are literally living in the home. They see your private family matters, your financial details, your personal routines. They interact with the other household staff. They travel. They integrate into the lifestyle in a way that goes far beyond just clinical care. That means you're not just hiring medical expertise, you're hiring someone who will be a part of the household. They need to understand and respect the specific culture, structure, and privacy standards of the home. And here's the thing. Skill alone is not enough. A nurse might be clinically excellent, but completely inappropriate for a high-net-worth household environment. Professionalism and discretion matter just as much as clinical ability. Let's start with the foundation, discretion and professionalism. In your home, a nurse sees private family matters, medical issues, health vulnerabilities, and personal routines. You must expect strict discretion and confidentiality at all times. A qualified live-in nurse follows clear privacy standards and respects household boundaries. They do not discuss your family, your visitors, your medical issues, or anything they observe outside approved channels. They understand that even casual comments, talking to a friend about what they saw, posting anything on social media, or mentioning details in a conversation that gets overheard can harm trust and compromise privacy. Professionalism shows in daily behavior. The nurse arrives on time and dresses appropriately for a household setting. They communicate in a calm and respectful tone and document care clearly and follow agreed care plans without cutting corners. When you're reviewing candidates, confirm background checks and license verification. A reputable agency should explain their detailed vetting process, including comprehensive background screening and professional reference checks. This level of oversight supports the professionalism and discretion needed in the home. And here's something important. You should require a formal confidentiality agreement or a non-disclosure agreement. This isn't just paperwork. It makes clear that privacy is non-negotiable and the breach of confidentiality does have consequences. Now let's talk about the clinical side, because that's the foundation of everything else. High net worth households often require complex care. Not always, but often. You might need support for post surgical recovery, chronic disease management, neurological conditions, or palliative care. Maybe you need newborn care or management of a very specific medical condition. A live in nurse must hold an active nursing license and current clinical training. They should demonstrate strong assessment skills, medication management expertise, wound care knowledge, and the ability to respond to emergencies without delay. Specialized skills matter when care goes beyond basic support. For example, managing feeding tubes, IV therapy, complex medical schedules, or specialized mobility equipment requires formal training and hands-on experience. You need to verify that a candidate has actually done this work before, not just completed a course about it. You should also look for strong clinical judgment. A skilled nurse identifies early signs of infection, medication side effects, or cognitive decline and takes action quickly. They don't wait around hoping that a problem just resolves itself. No, they act. This is where direct conversations with previous employers becomes crucial. Additionally, copies of licenses, certifications, CPR certification, and specialized training should be part of your file before the nurse even starts working in the home. In a private household, the small details shape the quality of care. You need a nurse who notices subtle changes, shifts in appetite, mood changes, sleep patterns, even skin conditions. These seemingly small observations often signal bigger problems that need attention. Attention to detail also supports safety. Accurate medication timing, correct dosages, and careful record keeping reduce avoidable risks. A nurse should track vital signs, fluid intake, and symptoms with precision. If something changes, you should know about it. But here's where it gets even more nuanced. Personalized care in high net worth households mean adapting routines to your specific preferences and lifestyle. The nurse should respect cultural norms, dietary choices, visiting schedules, and the roles of your other household staff. They need to understand that a private chef manages meals, an estate manager oversees logistics, and a personal assistant handles scheduling. Strong communication supports individualized care. The nurse needs to understand what matters to you and shape their approach accordingly. Now let's talk specifically about what it takes to succeed in a high net worth household environment, because this is where many otherwise qualified nurses struggle. High net worth families expect strict privacy and confidentiality at all times, like we mentioned earlier. Your home likely has security systems, NDAs, and limited public access. A live-in nurse must treat all medical details, travel plans, and personal matters as completely confidential. They should never discuss your condition with friends, former coworkers, or obviously on social media. Even very casual comments like, "Oh, my client's recovering well from surgery," that can harm trust and compromise privacy. So this level of discretion should be as natural to them as it is to the estate manager or other trusted household staff. And again, just a reminder, it is critical that this nurse is able to integrate with the other household staff. Clear lines of authority are needed to prevent conflict and confusion. They need to learn who supervises schedules, who handles vendors, and who manages the overall household logistics. A nurse is part of a larger team, and they should act like it. Additionally, high net worth individuals often maintain complex schedules, travel frequently, and manage significant businesses or public roles. The care plan must support that lifestyle. Some families operate formally, with structured communication through assistants. Others prefer direct updates from their medical team. You should clarify early how you want medical information delivered and how often. The nurse must stay neutral in family disagreements. Their job is to focus on patient care while maintaining professional boundaries at all times. Now let's talk about how to actually find and vet the right person. You protect your privacy, assets, and health when you apply strict hiring standards. A live-in nurse must pass detailed screening, hold verified credentials, and show proven experience in private service settings. Don't settle for a very simple basic background check. You should require multi-layering screening, including national and local criminal records, identify verification, employment history, and license validation. For high net worth households, you may also request credit checks and civil record searches. These steps help reduce financial risk and confirm professional stability. And reference checks should go beyond written letters. Speak directly with former employers, especially those from private household staffing roles. Ask specific questions about discretion, reliability, and how the nurse handled sensitive health issues. If the role includes newborn care or pediatric support, confirm hands-on experience with infants in the home setting. A nurse who has worked alongside a nanny or governess in a staffing household should understand boundaries and team dynamics. Document every step. Clear records protect you if questions arise later. Many high-profile families rely on agencies that specialize in private household staffing. These firms pre-screen candidates, verify credentials, and assess personality fit before presenting profiles. When working with an agency like NurseRegistry, ask about the vetting checklist, how they test clinical skills, whether they conduct in-person or video interviews, and the replacement policy if something doesn't work out. Always expect clear contracts, defined duties, and a structured trial period. A short-term trial helps you assess professionalism before making a long-term commitment. Finally, let's talk about setting yourself up for long-term success with a live-in nurse. Always establish clear boundaries and expectations. Define duties in writing before the nurse starts. Spell out clinical tasks, reporting lines, schedule blocks, travel expectations, and on-call limits. Set clear rules around privacy, access to private spaces, and communication with you and the family. Clarify who gives medical direction and how updates should be delivered. Boundaries protect both sides, reduces burnout, and support a true long-term commitment instead of a short placement that burns out quickly. And don't forget about investing in professional growth. You strengthen retention when you invest in the nurse's skills. High-level care in a private residence requires more than just basic credentials. We know this. Encourage advanced certifications, continuing education, and training in specialized care. If your household includes complex medical needs, fund updates in equipment use and emergency response. Professional development signals that you expect excellence and plan for a long-term relationship. So finding the right live-in nurse for a high net worth household requires more than just checking credentials. You need someone who is clinically excellent, deeply discreet, professionally mature, and comfortable operating within a structured household environment. The investment you make in hiring carefully, vetting thoroughly, and establishing clear expectations will pay dividends in the form of better health outcomes, preserved privacy, and a household that runs smoothly. Look for nurses with strong credentials and proven experience in a private household setting. Prioritize discretion and professionalism just as much as clinical expertise. And remember, this is someone who will be integrated into the family in ways that normal employees aren't. Take your time during the hiring process. Ask the right questions. Check references. Don't settle for someone who doesn't understand or respect the unique demands of the household. And if you need help during this process, remember, NurseRegistry is there for ultra-high net worth families in California. We take vetting incredibly seriously, have worked with many VIPs to ensure that specialized private nursing, confidentiality, trust, and discretion is always a main focus. Thank you for spending time with me today on Care Conversations. I hope this episode gave you valuable insights and practical takeaways that you can use. If you found this helpful, please subscribe and share it with someone who might benefit. Remember, quality care starts with quality information. And whether you're managing your own health or caring for a family member, you don't have to navigate alone. For more resources and expert nursing care, visit NurseRegistry.com. But thank you so much for listening, and until next time, take care.